Good evening, everyone, and thank you for tuning in. It's another Friday when She Chooses to Live comes on air and tries to teach people or to give people knowledge so that they are able to make right choices in life, especially choices matters health. So we are here again today, the 18th of June, and we are glad to be here. There have been very many questions from people, so we thought we'd take this session as a question and answer session. Again, from the platform of She Chooses to Live initiative. So next to me here is the tech guy. She's the one who puts us on online and removes us at the end of it. And she is quite a good tech guy. So I'm glad to have her as my tech guy. Or is it a tech girl, whatever. But she's a technical person. I'm Dr. Jane Wakai. I'm an obstetrician gynecologist of many years, and it is our feeling that there is a lot of lack of knowledge in this, especially our country. We find a lot of knowledge in the Western world. People know about themselves, about their bodies, but in our country here, it's a bit like people, especially matters sexuality, people don't want to talk about them. And then they are so natural, they are so central that they are as important as having food. So we have to actually demystify them. We have to talk about them and let people make choices early enough to be able to not go through some diseases where they would say, we wish we knew. So that's what She Chooses to Live does. We there Today, like I said, we are doing a question and answers. Uh, there have been very many questions asked, so we will not even be able to answer any significant number. Before we start, I want to say that there is one particular one that has really been asked about kegels, and that would take the whole session actually to explain about kegels. So allow me to postpone kegels and make it as a session to talk about kegels and why kegels and who needs kegels and such things. The other thing will not be able to manage so shortly because I don't want to just touch and then people get nothing. The other thing we'll not be able to discuss is uh, death of a baby inside the uterus. Again, it has been asked very many times. Death of a baby inside the uterus and the abnormalities that happen in babies. So we'll take that as a topic, abnormalities in babies, what causes them, and the death of babies. We'll take again that as a topic. And the other question that has been overwhelmingly asked is about delayed periods, missing periods. Are we menopause? Are we pregnant? We are not pregnant. Why are we not getting a period? So again, abnormality of periods, we will not be able to discuss that first. So those three topics, we shall defer them and give them to us as real topics on a session by session by session, because the time we are given by Facebook Live, we cannot cover everything. Now we want to start, and before we start, I want to say thank you to Joanne. Now I'm talking about Tinoro, Joanne, Waihora, Jenga, and Dagetari Kenodia for hosting me, because quite a number of these questions have come from that session. So welcome everybody. We'll start the as many questions as we can answer in this, but I do want to say that I will try to answer as deeply as we can, so that if some questions are not answered, we will answer them another time, but we will just answer as they came. But those three sessions, those three things I've mentioned were so frequently asked that it's not possible to really answer them. And they are too long. It's not possible to answer them that quickly. So tech guy will read the questions, and I'll answer as many as we can manage in the time we are given.
So the first question says, hi, I am 53. Last month I did not menstruate, but I am not pregnant. Thinking I have started menopause. I feel tired. My whole body feels tired. Please give your advice.
That age 53, you are allowed to actually start menopause. So it could be menopause, but we don't say it is menopause when it is only 1 month. Science used to say that we wait at least a whole year without a period. So if you've not seen last month, you need to wait another 11 months to confirm that you're in menopause. So most likely you are in the area called perimenopause. There's a time, again, menopause is a very, very big topic. There's, if you look at our talks, there's a time we talked on menopause. So if you go back there, you can see a bit of the advice. And yes, feeling tired, feeling irritable, hating everybody, being unable to sleep, putting on weight, those are menopausal things. So, but like I said, 1 month is not enough to say menopause. You could still get your period. Maybe the area that is jumping a few months and then finally it will stop. So yeah, that's what it could be. Oh, before I stop, let me tell you that if you are skipping periods and still getting a period here and there, you could still become pregnant. So be careful about it.
All right. The second question asks, I am 23 years old. I am married, and since sorry, let me read this in Kiswahili because I think I was trying to translate.
Oh.
It says here, niko na 23 years and I'm married. Na tangu nijifungue about 2 years ago huwa nalala napata nimekojoa kwa kitanda only at night. Shida ni nini, please?
May I please beg that when you say the question, send it in English. I'm very I'm very poor at Kiswahili. In my generation, we were not taught Kiswahili in school, so you will hear me talk Kiswahili Kikuyu. So forgive me. But yes, I think I can get the gist that she's 23 and she delivered, and urine just comes out when she sleeps.
Yeah.
Okay, that could be when a woman delivers, what is called the pelvic floor. I think I discussed urine incontinence the other day. Anyway, what is called the pelvic floor goes a bit loose. So it may be that it's just loose pelvic floor that you have, and that if you do that thing called Kegels, the one I said I'm not going to discuss today, if you do that thing called Kegels, then you are likely to tighten your muscles and the urine is likely to stop leaking. However, after delivery, you could have sustained something called a fistula, a little hole that connects between the urinary bladder and or the urethra itself and the vagina. So get yourself checked by a doctor to confirm that all that you have is loose pelvic floor. And if it's loose pelvic floor, then you'll be advised to do Kegels. And like I said, we shall discuss Kegels on another day. It's a very long topic.
Hello, Daktari. So you let me read this question. If you have a difficulty understanding, I'll
Soma la Kiswahili.
Okay. Hello, Daktari. My milk ilipotea after taking chaguo langu pills.
Okay.
At 6 months. I really want my milk back, and imepotea kabisa. What?
I'm so sorry. I'm so sorry. What? It's not funny, I know. Yeah. It's not funny. You have a baby to feed.
Yeah.
And it's not funny. Now, chaguo langu is a pill. It's what is called a combined pill. And that's why we advise you to not take pills before 6 months are over, when you're exclusively breastfeeding the baby. What the combined pill has is it has something called estrogen and something called progesterone, and those do reduce milk. The one called estrogen reduces milk. So we don't, in fact, when you deliver, if we are going to give you a pill, we give you what is called a breastfeeder's pill, which is progesterone only, so that your milk is maintained. So you can do two things. You can either stop the pill and use something else that is not hormonal, something like the coil, or you can have something called an implant implanted, because that one is progesterone only. And but the main thing you need to do really is to make sure that even if there is little milk, you breastfeed your baby, and you pump those breasts, because even with chagola or chagola, even with a pill, when the milk goes a bit down, if you force those breasts to produce milk, they will produce a milk. So because breasts tend to produce milk on demand, so if you let the pill take it down, it will stay down. But what you need is to drink a lot of water, a lot of water, a lot of water, and then pump your breasts if you are going to continue on the pill. And even if you're not going to continue on the pill, you still need a lot of water and to pump your breast and to feed the baby many, many times, so that the breasts are stimulated. But yeah, pills are expected to take away your milk.
Good evening, doctor. What causes a child to have some body parts not fully developed?
That's the one we are going to discuss with with babies dying inside. Uh, it could be many things. It could be genetic. It could be medicines that you took in early pregnancy. It could be infections with viruses. So that's a big topic. That's one of the topics I said we'll discuss as a topic, alongside with a baby dying inside the uterus or a baby being born dead. So give us, permit us to discuss that on another time, and we shall discuss it really. It is an important topic, and a number of people have asked about it.
Okay, so nilijifungua mtoto wa kwanza akiwa na low calcium na ilikuwa low sana. The same thing ikafanyika na mtoto wa pili. Nikiuliza daktari akasema ati mimi niko sawa, shida ni nini?
Low calcium is common. You see, when you get pregnant, the baby has to make their own bones, and bones are made from calcium. So you need to take food that has a lot of calcium to be able to give your baby enough calcium to be able to make good bones. Now, the foods that are good in calcium, one of them is milk. The other one is something like fish. Quite a bit of legumes have a bit of calcium, not much. So you need, most of the time, you need supplementation of calcium. Either you are taking a lot of milk, normal milk, maziwa mala, maziwa lala, or yogurt or something, but you need much of the time supplementation of calcium. And not only that, the other thing that helps your baby to even reabsorb calcium properly is having vitamin D, enough vitamin D. So please, pregnant women, go to the sunlight and get yourself vitamin D, because the way to get vitamin D is you need ultraviolet light to be able to convert the unusable vitamin D into usable vitamin D. And that's the only way you will help yourself to be able to absorb calcium. So you need vitamin D to absorb calcium, and you need calcium to be absorbed. So yes, you need calcium supplements. You need to be checked. If you're not going to the sunshine very frequently, you need to be checked for vitamin D. And if it is low, you need to take vitamin D, both vitamin D and calcium.
This is hello doc. I saw you on Inoro TV and I liked the discussion. I am a first time mom, 2 months now. When can I start clinic? Someone was advising I start taking IFAS tablets because she used them when she was pregnant. Can I use them? And how many months is it safe to use them? Help.
As soon as you know you are pregnant, please seek medical advice. Reason being that pregnancies can be either in the uterus or they can be what we call ectopic pregnancy. So you want to talk to a medical person early enough to know that your pregnancy is okay, it is sitting in the right place and it is growing well. There are times when even a pregnancy will bleed, what we call a hidden bleeding, what is called subchorionic hemorrhage. It will bleed, and if we catch that bleeding early enough, then we are able to support that pregnancy, and much of the time it lives. If we don't catch it early enough, then it will bleed, and the baby will be, the pregnancy will demise. So as soon as you know you're pregnant, kindly go and see your medical advisor and get checked that the pregnancy is okay. And that is as soon as about 6 weeks. The baby's heartbeat appears at 6 weeks. That is 6 weeks from the first day of your last period. The baby has a heartbeat. And so that's a whole person. Now, about taking drugs, please don't sabasa each other. Don't sabasa drugs. Just go to a medical person. You don't know why they were given, what drug they were given. You don't know what their condition was. Just go for yourself and get yourself checked and be given the right drugs. Having said that, this I will say that every woman who is pregnant or planning to get pregnant needs to take folic acid. That's the only medicine I can tell you you must take and you should take when you want to become pregnant or when you are throughout pregnancy. Other drugs, please consult your doctor.
Sorry, got out of line a bit. Sorry. Hi, doctor. My period is late for. Okay, sorry. You know, sometimes I think sometimes when these questions are asked, the sentences are a bit, they're not very clear.
Yes, I'm
Hi, doctor. My period is late. I had my last period. Let me paraphrase her question. My last period was on 4th May. The date now is 10th June. I'm not yet pregnant. What is the problem?
That one need to know a bit more. I need to know, are you on the pill? I need to know, did you take the morning after pill? I need to know very many things before I can answer that one. But it's not very unusual to miss periods, and that's the other topic I said we'll discuss a lot about. It's not unusual to miss periods. You could have traveled, you could have um, something major could have happened in your life to psychologically, I mean, physiologically alter you. So I do not know what the reason is. I would have to know more to be able to answer you that question.
Hi, Dr. Jane. I have been watching you on Inoro TV and I got interested to know if bleeding after having sex, 9 weeks after having a C section, is something to be concerned about. Please help.
There is a question we shall look at that one.
Okay.
There's also a question from a man about bleeding after sex. Now, bleeding after sex is a no-no. There must never be bleeding after sex. The only time that a woman is allowed to bleed after sex is the very, very first time when her hymen is still intact. In fact, there is, I'll not say which community, but there's a community that has to check the bed sheet when the girl gets married to confirm whether they were virgin or not. Now, let me advise you men, the only time a girl will bleed is if the hymen is still intact. And the hymen is a very delicate something. It's a very delicate part of the body that can break when on riding a bicycle, on having a fall, on anything. So the fact that a girl does not bleed the first time does not mean that her hymen had been broken in any other way. It could have been broken in a natural way. Now, let me not digress to the communities that want people to bleed the first round. But anyway, that's the only time that bleeding after sex is allowed. Any other time, something is not right. And the whole of the reproductive system is big. So somebody could be bleeding, that we are talking about the girl of post after cesarean section, and the man whose partner bleeds after every time after sex. So it could be anywhere from. Let's start from the outside. It could be that there is something, some lesion, some ulcer on the. When I say lesion, I mean ulcer. Some ulcer on the vulva that is making somebody bleed. There could be some ulcer or wound in the vagina itself that could make somebody bleed. There could be, and this is what I want to emphasize and why we must answer this question today, is that bleeding after sex could be a sign that a girl has cancer of the cervix. So please, whether you have delivered 6 weeks ago, you shouldn't be bleeding after sex at all. And it's nothing to do with your cesarean section. So bleeding after sex is something to be taken very, very seriously. Go to your doctor yesterday and have that whole of reproductive system checked, because you might find that actually she's bleeding because she's starting cancer of the cervix, and it could be something very early that could be dealt with. So please do not ever take bleeding after sex lightly. It is something that needs, it could be, I'm not saying it is cancer cervix. It could be something as little as what we call erosion of the cervix, going red and bleeding after being touched, or just the vagina got a lot of friction or something. But it could also be that it is cancer of the cervix. So please go to your doctor yesterday, get yourself checked. The lady who bleeds after sex and the girl who after cesarean section bleeds 6 weeks later, or anytime really, not 6 weeks later, anytime after sex, you must not bleed.
Sorry, could that be a condition of rough sex?
Then it wouldn't be after every time that sex happens. And even if it is rough sex, it needs to be declared as rough sex and not cancer of the cervix. Rough sex would also be, the girl would feel pain. It would be, they would also be complaining that it's painful. But
they might not complain.
They might not complain.
They might just,
No, girls, stand on your rights. If you feel you are being molested, say so. But anyway, main thing, bleeding when having sexual intercourse is wrong. It is never right.
Hi, Daktari. I am 26 years old with one child, 6 years. Last year I was pregnant, but October mimba ikatoka na ikaoshwa, being admitted in Othaya Hospital. Since then, my periods have been irregular na zikikuja zinakuja only a spot. Alafu nimejaribu kupata mimba ingine sipati. Nimeenda hospitali, nimefanyiwa every test, pia pelvic scan na sina shida. What might be the problem? Kindly help.
She miscarried when? In October?
Yeah.
October. We are now in June.
Yeah.
The body takes a bit of time to stop being pregnant, to stop the pregnancy state. So it could have taken the whole of October, November, December for your body to, even January, for your body to know that you are no longer pregnant, and for it to start producing eggs again for you to become pregnant. So the fact that for the last 6 or so months you have not become pregnant would not be a very big worry. Also, the fact that you're getting spots may be that the area that gets ready for the baby is not quite ready yet, especially if you washed, then it can stay a bit of time before it rebuilds nicely to become able to receive the baby. So that you're getting periods every month is a good thing. It means that you're most likely your ovaries have restarted and have known that you are ready to become a mother again. But it's not anything to worry very much about. If you finish a whole year without becoming pregnant and you're having regular sex, then you can go and have a checkout as to whether your tubes are still open or not. So if you are having good periods month after every month, and then the flow will become heavier because your uterus will start to get itself ready to carry a pregnancy. If that happens and you finish a whole year without getting a pregnancy, then you go and get a checkup. We do not rush to do the checkup of whether tubes are open or not, because that's an X-ray we use, and we really reserve X-raying the pelvis as or anywhere in the body as much as we can. So at least we wait at least a year to say that yes, there's a problem. She's not getting pregnant, but that will take at least a year. Now water. Okay, read the next one as I take water.
I think this have been 10 questions so far. Yeah.
We answer 10. Or we answer 12. Then are there in the on this
is I read this. There's one question here. One.
As far as do this one, who asked long ago?
Okay. I'll drink my water after you.
Okay. Somebody's asking about fertility.
Yeah.
Fertility supplements to improve egg quality. How long should they be taken? I would need to know which ones we are talking about. I would need to know their name because not everything is taken equally. But the one thing that you should take is folic acid for sure. You should start about 6 months before you plan to become pregnant. And then fertility supplements taken to improve egg quality. I'd like to know which ones those are, but folic acid must be taken, should be taken. It improves the egg quality. What folic acid does, it strengthens the wall of each cell that is formed. So it strengthens the wall of the egg that will make the baby. And then also when the baby is being formed, it strengthens every cell that the baby forms so that it prevents against congenital malformations. So you want to take folic acid at about 6 months before, but if you have not taken, not to worry. It's the minute you know you're pregnant, you take. So you take 6 months before you're pregnant and throughout pregnancy. We can go to the next question that was asked long ago.
All right. This one is all right. Hello, Dr. Jane. I'm from Naivasha. niko na 3 kids, wa mwisho ako 4 months na huwa I don't feel my hubby. I don't enjoy at all our intimacy. Also, sorry, just give me a minute. Okay, I lost it.
That guy needs glasses.
I'm avoiding them because they reflect. That's
Oh,
why. So she says she doesn't enjoy intimacy with her husband. She doesn't feel her husband, and she has issues holding urine, and she leaks urine.
yes. That's the one we said we'll discuss Kegos, and you see, that's a second question of the same, because we had talked that question, and I told them that it could be just the looseness of the pelvis, but that she needs to be checked, that also they need to be checked that it's not a fistula that they are having that is making them leak urine. But yes, you need that thing called Kegos, and you have permission from me to Google Kegos. But one day we shall sit here and talk Kegos. Or did I ever talk Kegos? I can't remember.
I don't think you've ever done as a session on its
On
own.
Kegos, okay. We shall sit here and talk Kegos, but you have on Kegos, you have permission from me to Google. Many other things I don't give permission, but Kegos, go ahead and Google. You need it.
This lady has come back. She's saying fertility supplements like Promimba.
Oh, those ones. Okay. You, I'm sure you are given by a doctor. You should take them a bit before pregnancy, and they are supposed to improve the fertility and the quality of the egg. And usually it's for people who are having a bit of a difficulty in conceiving. Most people just find themselves they conceive. So again, discuss with your doctor how long each, and because each person has a different that is different. You can tell where I come from. Has a different has a different ovulation strength. So let your doctor deal with that. Yes. But the one thing, like I keep telling you, the one thing you have to take is folic acid. Whatever else you're taking, take folic acid.
Okay, there's a lady here. She says, "Sorry, I'm late. I trust you're all well. Have you covered the question I had asked through your inbox on how an expectant lady can build blood levels and how to deal with morning vomits and metallic tastes?"
Is it another?
I don't think we've reached it.
Most likely we haven't reached it because we haven't discussed the pregnancy. We haven't discussed early pregnancy, have we? Okay, continue.
So do you want to answer that?
We answer that one.
Yeah, answer that.
Sorry,
how can an expectant
blood levels and how to deal with morning vomits and metallic tastes. Okay. So when you become pregnant, I like to tell my people they're just containers. So you're a container of a baby, and this baby is landing on you and has its own space. So what the baby does is it produces its own hormones, and those hormones, they upset your own hormones. So we get very happy actually when we hear that you have a metallic taste. We get very happy when we hear you're nauseated, that things are smelly, because we know that your baby is actually producing enough of those hormones to be able to affect you. So what to do about morning vomit is you're likely you're one of the people who vomit in the morning. Some people, you're lucky it's only morning. Some people vomit whole day. And that's because of the pregnancy hormones, the level of the HCG that the baby produces, the hormone that the baby produces. So there is the good thing is that the hormone of HCG goes very, very high the first. It goes in a very steep manner, starting from about week 6 all the way to week 12, and then it flattens. So the good news is that for a number of people, about 80%, after week 12, the pregnancy, you will accommodate each other. You, the container, will be allowed to live by the baby. So you'll accommodate each other. But 20%, you will still be a container throughout. But things like smells and things, those will not go. So the metallic taste will be there, but hopefully for you it will go after week 12. So enjoy your pregnancy. Now, how to go about mourning is if you can take antinosic, antinosia, the Nosic tablets that help you not to vomit, or a better remedy, maybe if those are not working, is to take very dry toasted bread before you even brush your teeth, because a lot of women will vomit before they brush their teeth, and that's because the whole night they have been accumulating juices, intestinal juices, stomach juices, and the minute they try to eat something, they will throw up. So what the toasted bread does is it soaks down that liquid, and you toast it almost to burning so that it has like charcoal. When it is that way, it takes not only the liquid but the gas also from your stomach, and it will ease you. And then after that, you can eat and then brush your teeth. So welcome to pregnancy, and embrace it. It's a good thing. Yeah. I think we will have to answer only one more because we'll be thrown out by Facebook.
No.
Okay, we go on as far as we can. So yes, do some anti-nausea medicines. Get your doctor to give you some anti-nausea medicines. Don't expect them to always work. The other thing is start taking dry food and then taking liquids after. There's much we can discuss, but yeah, those are the basics. But if I were you, I would be smiling. Yes.
I think this is one of those you said you'll discuss later on. It's talking about the fetus didn't develop properly, and the baby was born breech. The baby's heartbeat was not normal. So I'm guessing when you're doing the topic about fetal development.
Actually, that's the one who said that her baby died at 8 months inside. So
Yeah.
she's one of the people that we will do a full talk on what kills babies when they're in there.
Okay, all right. So the next question is: I listened to you, Kimori. What is it called?
Kimori.
Kimori.
Yeah, Kimori.
Sorry.
Okay.
I turned 43 years, mother of 3. I have always had that feeling of getting a baby boy since I was 40. And my husband also desires the same. I have seen like 3 doctors and all discouraged me that I might get an abnormal baby. I even did a blood test but can't remember the name. Showed a fertility of 0.001. I think what she's saying is she has 3 girls.
Yeah. Well, whatever. 43 years with a fertility, I think you are talking about anti-Mullerian hormone AMH of 0. Whatever it is.
0.001.
That makes you, well, it doesn't make you infertile. What that means is that your ovary reserves have gone way down, and it's unlikely that your ovaries will be able to produce an egg to make a baby. Point 1. So you're unlikely to become pregnant, but with that kind of AMH. But we have seen people who ovaries go to sleep and then wake up again. So you could become pregnant. But the older us women get, the more chances that we are likely to make an abnormal baby. I, the way I illustrate to people is that when 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 a woman starts getting babies, then when the ovary starts to bring out eggs to make babies, then it starts with the good ones. And of course, you want the good ones first because you want good babies. And towards the end, then the not very good ones are what are remaining. So it is likely that you could be looking for a boy or a girl or for any kind of baby, and you get an abnormal baby. And yes, I concur with those doctors. That could happen. But also your AMH seems, your fertility level, the reserve of your ovaries seems to be quite low.
I think you can answer this one quickly. It says, can I eat pineapples when I am pregnant? Please give me a full list of fruits I can eat when I'm pregnant.
I can't remember all the fruits you can eat when you're pregnant. And yes, you can eat a little pineapple, not much. Pineapple has a certain acid that you don't want to eat a lot of when you're pregnant. In fact, pineapple, reserve it for when you deliver and you are constipated. But you know the statement that an apple a day makes the doctor happy. It also makes the baby happy. So eat fruit. I don't know which fruits to tell you to eat. Eat apples. Well, no, we are Africans. They are apples. Yeah. We eat apples. We eat grapes. We eat what other fruits are there?
Popo.
We eat popo. We eat actually, especially oranges for vitamin C. Thank you. So eat all fruit in moderation. But the one you are allowed to eat as much as you want is orange. That one, and apple. You can eat that as much as you want. But mango, especially when it comes to season, I've seen it make my girls very, very fat indeed. The ones who are pregnant, because they crave mango, and they tell me they eat 2 or 3 mangoes a day. And mango is good if you eat half a mango or 1 mango. Do not overeat mango. Do not overeat banana. Oranges you can eat as much as you want. Pineapple, eat a little. Whatever other fruit. Yeah.
Okay. It says, hi, Dr. Jane. I've just seen you in an oral. I was unlucky my question was not reached. I am 23 years old. I gave birth to a boy last month, but now I'm feeling lower stomach discomfort. And when urinating, when I'm almost done, I feel like I am tightened. Please help.
But that is most likely a urine infection. Either you have an infection, or because you are breastfeeding, and breastfeeding, boys, is not a joke. They feed, they really feed. So because you are breastfeeding, you may be getting dehydrated, and your urine may be getting a bit acidic. And that could be the reason why when you pass urine, then your bladder tightens because it hurts. But you need to go to a doctor and get checked that it's not a urine infection, because a urine infection, it's very common in pregnancy and around delivery. So go and confirm that it's not a urine infection, please.
There's someone here from Chuka who says that she has a daughter who's 17 years old and is yet to get a period. She hasn't got her first period yet. What might the problem be?
17 years is a bit on the older side to not have gotten periods, especially these days, when girls are mothers at age 9. Having said that, we cut off at age 18. Every girl must have gotten a period by age 18. If they haven't gotten a period by then they need to go and get checked by a doctor whether their reproductive organs are okay, and whether they are also growing like women, whether their ovaries are functional, whether their uteruses is there, blah blah, a lot of things. So if I think 17 is time to take her to get checked as to why she's not getting a period, because it's for the kind of foods and generation we have now. girls are getting periods between age 9 and age 14. If it goes beyond that, it's a little bit on the later side. Now I'm starting to get tired. Last question. Then we shall defer off the others. My throat is refusing.
You want to do one more?
Mhm. One more. Okay. Okay. Is there any here?
No, here we
Okay.
just have some comments saying this is very informative, thankful. Thank you, Doc. We are learning a lot. Thank you, Daktari. Tuned in, learning a lot. And we appreciate you too all the time. Oh, this is a nice one. Thank you very much. So
Then we can stop there. We've done 45 minutes. We can we had a lot of questions. They are very minimal. We've not even touched a quarter of them. We have a lot of questions, and we tried to arrange them in the commonality with which they were coming. And like I told you, those ones which I felt they would take too long, we will discuss them as a topic. Um, we do this only once a week, so we next week we might be wanting to finish the questions that were asked this week. There are very many questions that were asked that we can't answer in one session. So especially because my throat has been talking the whole day in the clinic, and it is talking now, and it is starting to get unable to talk. So but I think we can do one, but I think we have done or the very bad ones that need, go to the doctor. But yes, talk to me.
Okay, so this one I think is not a very difficult one to tackle. There's someone who's saying when she has a period, she gets clot like clot like clot
She
like
bleeds clots.
yes.
Okay. When we are getting a period, that is called the weeping of a uterus, a disappointed uterus, because the uterus was waiting for a baby, and the egg didn't get fertilized. Then the uterus has to shed the layer that was waiting for the baby, um, to be able to prepare for the next time. So the amount of blood that is shed, the normal amount of blood that is shed, actually ranges from 2 ml. And we are talking about the whole period that lasts between 2 days and 7 days. So the whole amount of blood that can be shed ranges between 2 ml to 60 ml. Now, when this blood is being shed, it flows through the area called the cervix. And the cervix is a very narrow opening, the one that keeps itself closed when the baby is inside to keep baby in. So it's a narrow opening that is you're taking blood through a narrow opening. So sometimes it is not possible to flow all the blood at once, and just where the cervix starts, at the top where the cervix starts, then the blood gets held there and kind of churns around, and makes clots. And when it makes clots, then the uterus has to really squeeze itself to be able to squeeze that clot out through the cervix, and it becomes quite a painful one. So what it means is that you are bleeding either a bit more than you should be bleeding. That's where you're bleeding clots, or your blood is your period is being finished quickly. Like instead of taking 4 or 5 days, it takes 2 days. So there is a lot to bring out. So clotting means that there was too much blood to flow through as liquid, and it had to be made into clots, which make it very painful. But if clots is what you're having all the time, kindly go and check why, because the most likely reason you could be having heavier periods than normal. So go to your doctor, they check why you're getting heavier periods than normal. It could be a number of things, whatever. Many things, which again we will discuss when we are discussing periods. It's another very common question among these ones that we got. So see a doctor and make sure that you keep your blood level up. Which reminds me, I didn't tell the lady of the pregnancy how to keep her blood level up. Which you need, the foods you need to eat to keep your blood level up is a lot of dark green vegetables, very dark green. In my village, there is terere, there is managu, there is cancera, there is spinach. Those ones, very dark green, and a bit of red meat, not much, maybe once a week red meat, but a lot of dark greens, a lot of dark greens. Then you raise your blood levels. And when you're pregnant, if you don't have enough, we normally would give you iron supplements to make sure that your blood levels are up. And the other thing about blood is that the less blood you have, the more you will bleed, because the blood is in itself innate, able to stop itself from bleeding. So you don't allow yourself to bleed too much, because then you continue, it becomes a vicious cycle. You continue to bleed even more. So clots, please see your doctor. It could be that there is a problem why you are having clots, or it could be that you are the type that gets the 60 ml instead of the 2 ml. And every woman comes with their kind of amount of bleeding. Yeah. End of story.
All right. So I think we'll say good night.
I think we'll say good night before another one pops.
Okay. Thank you so much. Thank you.
Thank you. We will tackle, we do another question and answer next weekend. Yeah. We will try to hurry up all the other questions that we didn't answer today. We had many. So we will try to answer those ones. You can still send some over the week so that we can combine them together. Then after we do that Q&A, we shall decide when to do kegels and when to do the abnormalities of fetal abnormalities. Now, I've given you permission to check kegels in Google. That one, permission granted. But kindly wait for us to discuss the abnormalities of the babies and the things that can cause abnormalities. Those ones, I think, let me tackle them for you. Okay. So,
okay, thank you. Good night.
Good night. Yeah. Hi.